Hello and welcome to another Pipe of Pearl. Today's Pearl, I'm going to try and educate you away from what is popular opinion and lead you towards science-based management. Now this is an incredibly difficult endeavor because the power of persuasion and the power of opinion is pretty incredible, and this story is yet another example of how media and sensationalized stories can lead to people adopting certain practices that aren't really based on science and are just based on assumptions made and then sold very, very, very well. Now, it's not just the general public that doesn't understand the physiology of the body that adopted this. The power of persuasion even has the ability to persuade clinicians and clinicians to write papers and pretty much offer recommendations that then lead to like a firestorm across and very, very popular opinion. Now, this happened in cases like the use of hard collars, a very similar story based on very weak evidence back in the 60s that just went rampant, and then protocols after protocol after protocol was written mandating the use of hard collars. Well, rice is pretty similar to that. You will continue to see protocols written with rice in it, despite the evidence that I'm going to show you today. So keep listening, and hopefully I can convince you that icing and using rice is not the best treatment for musculoskeletal injuries. And in fact, the old adage of resilience and walk it off, who would know that all the dads out there were correct all this time, is actually a better management in principle than using rice. So let's start the story off. And the story starts back in 1962. And you know the story is going to be good when I start it with 1962 is where the evidence came from. In 1962, there was a 12-year-old boy called Eddie Knowles, and he jumped onto a freight train. And this was in Massachusetts. And the young boy unfortunately severed his arm. So the young boy in the arm was taken to the Massachusetts General Hospital, where the surgeons, 12 of them, worked on attaching his severed limb. Now, this was the first time in history that a dramatically amputated limb was successfully attached back onto a person. Now, I say successfully because the actual reports says that it wasn't actually that successful. It was riddled with complications. They made a huge amount of errors, as to be expected with the first revolutionary surgery in reattaching the arm. But this story was obviously huge. It was massive. So all the media outlets at the time got hold of it because they wanted to know what happened. How has this massive breakthrough in science actually occurred? So the surgeons told them the story, and the media didn't understand most of it, obviously. But what they did understand is the fact that ice was used to keep the arm at bay until they were ready to attach it. So whilst they were preparing the body, they put the arm on ice. And from that story, they sensationalized that ice is used to treat and protect muscles. And before 1962, there was never, ever a single protocol to use ice at all on any musculoskeletal problems whatsoever. And with the newspapers running with it, it got general public aware, and they quickly adopted the notion that if you have any injury associated with the musculoskeletal system, that ice should be used. Now, it wasn't until 1978 that a Dr. Mirkin, who released a sports medicine book, so this is pretty high-end stuff, and he coined the acronym RICE. So in 1978, Dr. Mirkin coined the acronym RICE, and he was the one that came up with this protocol that was adopted and just so well known for the last 50 years. It was this one guy. And this was pretty much really undisputed. There was obviously a few studies here and there that were going, wait a minute, this is crazy. Why are we doing all these treatments? There's not a lot of evidence to it. But it wasn't really until 2013 that a Gary Reelan produced a book that was called ICE, the Illusional Treatment Option. And this was a very, very robust and researched book that used thousands of different research papers. It pretty much proved that rice was crap, and that was back in 2013. So that's how long it's been really well documented that rice isn't a good option, and yet even today in 2023 you'll still see examples of rice being coined and being phrased as the ultimate treatment. And it's very popular among patrons, sporting industries, and clinicians alike. So the word is really, really strong. So I don't really think this video is going to change anyone's opinion because it's been said many times before, but I'll see what I can do. Now you may be sitting there thinking that, wait a minute, one guy said it's good and then another guy wrote another book saying that it's bad. Well, that doesn't really prove anything because people disprove things all the time. Just look at the nutritional industry. There is contradicting information across the board. Well, the kicker is that following the release of this book, Mirkin himself, remember the original guy that coined rice, actually recanted his original position on the rice protocol, and that was in 2015. So the guy who invented rice in 2015 recanted it and said, oh, okay, new evidence shows that it's not the best option, and this ICE, the illusional treatment options, are actually a better protocol to go with. So please, people, stop using rice and start adopting the new modern principles that I'll go through today. Now, I'm fully aware that a really sensational story that was tightly wrapped up and almost irrefutable isn't going to be enough to sway people, especially the listeners and clinicians that have used rice in their practice for many years. Now, between the time of 2003, technically before, but that's when I started my clinical career, and up to around 2014, I myself was advocating for rice because why wouldn't I? That was the best evidence we had. But since 2014, I've done my part in saying that it's really not the best. Okay, so we'll go through just an explanation of what happens during the physiological response to tissue trauma. And that way we can use that to link why rest and ice and all the treatment isn't actually the best option. So you may be aware of this, but just to highlight a few areas that often don't get talked about. When we talk about the three phases, now technically there's four if you include hemostasis, but the three stages of tissue repair, we have inflammatory, and then we have repair, which is also known as proliferation, and then we have remodeling. Now this is the same that occurs whenever any cell in the body is damaged. It doesn't have to be the skin, doesn't have to be a wound. Any cell in the body is damaged. It starts with inflammation, and then it must go through inflammation before it can go into repair and before remodeling can occur around the same time as repair. They sort of overlap there. Okay, so if inflammation doesn't occur and doesn't end, then repair will not start. And that's basically the bottom line. So whenever any cell in the body is damaged, it releases inflammatory chemicals. This creates what's known as a chemotaxis. Now, once hemostasis is established after initial vasoconstriction, the body goes through natural vasodilation, and this opens all the capillary beds in the area and allows for specialized white blood cells, neutrophils initially, followed by macrophages, to go through a process known as diapetes into the area, release growth factors, and start the actual cleanup and repair. Now, the neutrophils and the macrophages will clean up and go through phagocytosis of the actual area, and that will leave a huge amount of debris in the area. And then it's the lymphatic system's job to come along and clean up all that debris in order to remove it, to move into the repair phase. Okay, now, a few key factors associated with the inflammatory phase is once we get macrophages to the area, macrophages will actually release insulin-like growth factor 1. And this is an essential hormone required for muscle regeneration. Without this particular growth factor, there is no such thing as muscle regeneration, okay? And that is released by the macrophages in inflammation. And if it wasn't for the lymphatic system coming along and cleaning the debris up, then the phase 2 repair and the regeneration phase and the production of angiogenesis, so the production of new vascular tissue, cannot actually occur. So if all the debris is kept there, then what actually happens is it increases the osmotic draw in the interstitial space, which results in more swelling. So if the lymphatic tissue can't clean it up, then you're actually going to get a huge amount of excess swelling and the inability to optimize the recovery of that tissue. Once the repair phase kicks in and you start getting the laying of the fibrous tissue, then that will kick into the remodeling phase, which needs good blood circulation and clearance of waste tissue in order to actually optimize repair. And without those factors, it actually will not happen. So to recap, if we do not have the insulin growth factor, we will not get muscle repair. If we do not have the clearing of debris, we will not optimize the area by reducing swelling for fibrous tissue to actually grow and for new vascular tissue to form. And if we don't maintain blood flow to the area during the recovery phase, or remodeling phase, then we will not get optimal repair. Okay, and that's the bottom line when dealing with the physiology of tissue trauma. So let's move on and talk specifics. What is the actual problem with rest? Now, rest is a tricky one because there will be a period straight after the injury that the person needs to stop. They will need to stop, they'll need to rest because of the pain. Now, when you stop and you don't move because of the initial pain associated with an injury, that's not rest. That's not what we're talking about with rest. Okay, but when you have prolonged rest following an acute injury, it does not enhance the recovery process. It does the exact opposite. As I mentioned, the lymphatic system is responsible for draining the accumulation of waste products and damaged tissue. So, in other words, it's vital in clearing the area and reducing inflammation. The lymphatic system doesn't have a heart, so it relies solely on muscle contraction in order to optimize lymphatic flow. So if there is no muscle contraction, then there is no lymphatic flow. Now, on top of lymphatic flow, the muscle contraction itself will actually promote the release of another growth factor, and it's actually a pro-angiogenic growth factor. And what that means is it actually allows for the creation of new vascular tissue during the repair phase. Now, this growth factor is called VEGF-A, okay, and it's vital in the actual generation of vascular tissue, and it's only released as a result of muscle contraction. Now, muscle contraction also inhibits a growth factor that's responsible for inhibiting muscle growth called myostatin. So if you don't contract your muscle, then myostatin will increase, and if myostatin increases, then it leads to muscular atrophy. Muscular atrophy leads to greater risk of further injury and also lessens your return back to full function. Okay, so that's what rest does to the body, especially during the inflammatory phase and the repair phase itself. And when you couple rest with ice, then you compound the issue. So ice is probably the worst thing you can do. There's the most evidence associated with ice being the worst, and when ice is coupled with rest, it just sort of compounds it. The general premise of ice is that it reduces inflammation. Now, a lot of people have gotten confused over the years, and they've actually connected, or they don't see the difference between inflammation and swelling. Okay, they're not the same thing. Okay, you can have inflammation in the absence of healing, but you cannot have healing in the absence of inflammation. And swelling is a result of increased fluid in the interstitial space that is prolonged and basically stuck there. Now, when you put ice on an area, it causes vasoconstriction. Now, this vasoconstriction will actually impede the transport of chemicals like neutrophils to the trauma site. If it doesn't have the neutrophils can't make the chemotaxis for macrophages to come along. Therefore, the whole inflammatory phase will be prolonged. On top of that, the prolonged vasoconstriction, which can occur well after the actual removal of the cold state, can cause further tissue damage. And as I mentioned before, any tissue damage results in the start of an inflammatory phase. So you can retard the inflammatory phase initially, and then using ice continuously can actually cause to a prolonged inflammatory phase that you stop with ice. And it's just this cycle that just doesn't really end. On top of that, when you put ice, and you put ice on for too long, it actually causes lymphatic vessels to dramatically increase in their permeability. So they become incredibly leaky. So you've got that, coupled with the reduction of the removal of all these byproducts, the increase in osmotic draw, which complicates and profounds swelling. So ice will actually make swelling worse. And if that's not bad enough, it also prevents the release of that insulin growth factor released from macrophages during inflammation. And without that, there can be no muscle repair. So you've got all these negatives associated with ice. So the big question is why on earth do you do it? It's causing more tissue damage, and it's causing more swelling. It's retarding the actual growth of muscle. Why on earth do we ever do ice? And the bottom line is, it feels good. Ice is beneficial for pain management. So as a double-edged sword and a lot of other things out there that feel good, it is actually causing your body harm as you do it, which is the kicker, which is why it is so difficult to stop people using ice in the immediate sense, is because it is effective at pain management, but it is not effective at all at actual supporting repair and regeneration and getting the person back to function. Now, people have been aware of this for a while, which is why they've come out with different sorts of protocols that say, oh, maybe just 10 minutes, maybe just a little bit, maybe 10 minutes and then take it off for 4 hours, and then maybe reintroduce it again. And it's just all over the place. The bottom line is any ice applied is going to reduce the healing capacity from the injury. So that is rest and ice covered. What about our compression and elevation? Well, the bottom line with those two is we don't actually know. And the reason we don't know is because they're coupled with the other two that we've pretty much proven are bad for the injury. So they're not really done alone. No one just goes along and goes, I'm just going to compress and elevate, which means the data and the studies and everything is not very good. So there's no real strong evidence. Now, compression is obviously fantastic for hemorrhage control, and it has been shown to reduce swelling, okay, because we use it all the time when people have edema, and we use it for hemorrhage control. So it has some merit in being used. The problem is there isn't any good protocol out there that says how much pressure you should use. What sort of resistance should there be? Now, elevating it, sure, same sort of thing. You're encouraging that venous return, you're encouraging the uptake, but elevation generally leads to more rest. And the best way to promote lymphatic flow and vascular return is actually movement and muscle contraction. So it sort of contradicts itself. So elevation out of the two really has the least evidence based on its effectiveness, whereas compression, it has that association with swelling and hemorrhage control, and it also has been proven to provide a psychological and, in some studies, a proprioceptive feedback for the individual as they're going through movement and as they're returning to exercise. It can give them that either placebo or the proprioceptive feedback they need to support the joint as they recover. Okay, so someone wants to use compressions, you want to keep using strapping tape, all this sort of stuff. There's still some evidence out there that it's not bad. All right, now for the big question. If we're no longer using rice, if you've all believed everything that I've said and it makes sense to you and you want to update your management of injuries, What do we go with now? What is the alternative? Well, good news is it's going to be nice and easy to remember, because all I'm really asking you guys to do is put the rice down and get some meat. That's it. Okay, so if you're vegetarian or vegan, this is going to be hard for you to adopt, but generally, hopefully it will be pretty easy. But the bottom line with all the new managements that are out there, okay, they're not very good at marketing. They're not very good at selling things because it hasn't really become widespread just yet. But the bottom line is active recovery is the actual important factor. All roads need to lead to active recovery. Everything you do in treatment has to promote active recovery. They tried to make an acronym that was called ARITA, so ARITA, which literally just stood for active recovery is the answer. Wasn't very popular, wasn't picked up, okay, but that was the first attempt that was coming through. Now, it was really around the 2016 mark that meat became more popular. What they found through a whole bunch of different sports studies is the importance of active recovery was really supported when they got groups of individuals that had injuries, and so they got professional athletes that constantly fatigue their muscles. And what they did is they got half the group to engage in 20 minutes post-activity recovery, working on the same muscle groups. So if they were doing a huge amount of leg works, the active recovery would actually involve leg work. Okay, and it was 20 minutes of active recovery on legs. Whereas the other group would do active recovery working on muscles that weren't part of the fatiguing effort. And they found that the group that used the muscles that were fatigued recovered so much better than the team that didn't. And this was obviously attributed to enhanced blood circulation, lymphatic draining of those minor muscle damage that was occurred during the actual main effort and the fatiguing event. Okay, so this was the same principle that was adopted in the repair. So it's just tearing of muscles or ligaments or tendons. It's the same sort of principle. So the idea of movement and actually using the area is what causes enhanced recovery to occur. So MEAT stands for movement, exercise, analgesia, and treatment. Now, I know it sounds ridiculous because movement and exercise are pretty much the same, and treatment is what you're doing, and I thought analgesia was bad. Okay, so we'll break it down and we'll talk about it. So movement is key. Okay, you need to move, and this is just moving the actual area through its range of motion. Okay, so we're talking active movement of the area that is injured. That's the first thing to do. So if it's an ankle, you keep moving the ankle. You're sitting down and you're moving that ankle back and forth. Okay, so that is good. That's fantastic. From there, we need to increase a little bit of resistance, and that's where the exercise part comes in. So instead of resting the injury, we're moving the injury, and then we're exercising with resistance. So this is the use of resistance bands or walking if it's an injury. And if it's associated with a tendon, there's actually evidence of eccentric loading should be prioritized when rehabilitating that particular tendon. Okay, so it's not just movement, it's actually adding resistance to that area as well to the point of pain. So we do all this up to the point of pain. If pain stops this, then we bring in analgesia. And only then do we bring in analgesia. So analgesia is only used in this protocol if pain is preventing optimal movement and exercise. That's it. That's all it is. Okay, now, as far as analgesia goes, Panadol is your first point of call. Panadol all the time. If they need to use other non-steroidal anti-inflammatories, ibuprofen and naproxen, those sort of things, then it's done for the shortest amount of time and only done to be used to allow for movement and exercise to occur. That's it. That's the bottom line. On top of that, we move into treatment. And treatment is the whole therapeutic approach. Okay, we're talking physios, we're talking nutritionists, we're talking all the different things that are out there. If you like acupuncture or anything like that, that is all fits under treatment. Okay, so the reason it's brought in is you don't need to do this alone. Okay? People don't need to recover alone. And the introduction of specialists like physios that can enhance those points of exercise is fantastic. So really, really utilize those, and that comes under the treatment part. Now, people that have a minor injury, they can start this meet the next day. Okay, we're not talking about as soon as the injury occurs, bang, you must put it through this robust movement, okay, because the shock of the pain's going to be there. Okay, so they're allowed to experience that pain and then work based on their pain threshold. So if it's a severe injury, then you still move them down the line that they go to physio. If someone can't walk and they fit the OTTA rules, and they still go down the line of x-rays and they still get medical treatment. This is just the treatment that is recommended for recovery. So in the acute sense, you're on the footy field, someone rolls their ankle. The best thing you can do is not apply ice. Just let them be. Take them off the field and encourage them to move their ankle back and forth. If it hurts, stop moving your ankle back and forth until it doesn't. And then when it doesn't, because the initial shock will dissipate, then you start moving your ankle back and forth. And then in time, you add a resistance band. And if it's too painful to work with a resistance band, then you take some analgesia. Okay? And if it's quite severe and you've done an examination and you think it needs referral, then you refer them on to all those different treatment options that are out there. Okay, so that is the treatment protocol, and that is how meat is used to replace rice. So that brings us to the end of the campaign of stopping ice being used in musculoskeletal injury and embracing meat and the old adage of walking it off. From here, as clinicians and as educators, okay, all first aiders are taught rice. So it's your job as a clinician to spread the good word, if you will. Okay, spread education around adopting meat principles over rice and actually working towards people recovering faster and better in order to get back to their full function. But until next time, take care.